Hmm? The adrenal gland sitting on top of the kidney from that cortex portion of the kidney, meaning it's going to act directly on the kidneys. So, once again, I come back to the statement, and your text, in the textbook, it states this almost at the beginning of the chapter. Fluid balance is going to be dependent on the kidneys. So, with potassium, aldosterone will get produced and it will go forward to help adjust the volume of fluids in the body. When we have too much or too little potassium, things go really bad in the body. In the case of too much, and in this case, potassium is kalemia, okay, so hyper-hypo. When it's too much, the nerve and the muscle cells, because this is the point that they're acting on, sodium and potassium are very important in muscle cells and in our nerve cells, okay? It makes the cells excitable and can very quickly produce cardiac arrest. So when someone's potassium levels are out of balance, the doctors are very quick to want to address this issue. If there's too little, usually from something such as heavy sweating, chronic vomiting, diarrhea, excessive use of laxatives, too much aldosterone, and then alkalosis, pH of the blood. And if it's alka, which direction are we leaning to? Acid or base? To a base. So this means the pH of the blood has become too basic. The symptoms, the nerve and the muscles are less excitable. The muscles get weak. They'll be having spasms. One of the things that becomes a problem, because once again, all of our organs are muscle. It doesn't signify one type of the three in our body, okay? It's letting us know that these issues can affect muscle and nerve, and that means any of the three muscles. One of the areas that's very susceptible to this is the lungs. And because it will make the lungs weak, have spasms, and possibly get paralyzed, the person will die. Basically, they'll suffocate. What I'm trying to get you guys to notice are the symptoms of what will happen in the body, okay? Our chlorine, one of the things that I said just a few minutes ago, sodium and chlorine are very important. Okay, they're huge contributors to fluid balance. Now, chlorine, I'm not sure if you guys remember, but go back and check it out. When we were talking about the red blood cells, because the red blood cells deliver oxygen, then we've got to pick up CO2. CO2, once it gets into the blood, into the water environment, begins to affect my pH. And one of the things that can happen, the red blood cell, you guys remember carbonic anhydrase to change it? We also had that chloride shift. The chloride shift that can happen with the red blood cells helps to balance pH in the blood. Just as a quick reminder, why is pH of the blood important?
Needs to be maintained. Nerve conduction.
Why do I need to make sure that my pH of the blood is kept within the normal limits? let's think back to our general bio class where we learned about proteins. What were some of the factors that could affect the function of proteins?
Change of the structure.
And what could change the structure?
Heat or increasing or decreasing the pH.
Well, pH changes.
Yeah.
Okay? What do I find a ton of in my blood? Protein. Keep my body functioning correctly. I got to keep the cells working correctly because pH can get messed up. And if you affect the structure of a protein, you have affected its function. One of the biggest proteins in the blood are the transport proteins. For example, the ones that will transport hormones to areas of the body that they need to go. So it's very important to maintain pH of my blood. So the chlorine has a huge, probably the greatest effect of anything wrong with my chlorine balance would be affecting acid base, the pH of the blood. Chlorine is strongly attracted to sodium, potassium, calcium, because when we take in salts, these are the ones that it's attached to. When we take in salt, we don't simply take in sodium chloride. We take in other chemicals attached. So, whatever happens with these, chlorine kind of follows them. So sodium, if I lose it, what's going to happen with my chlorine? Like if I lose it through my urine, chlorine's going to follow. In a case where the chlorines can be too high, usually it's from my sodiums. The natremium, okay, like I said, you guys have got to kind of remember the names. The kalemia, which is the potassium, or acidosis, meaning the pH of the blood is too acidic. Calcium, one of the things with calcium, we need it for muscle contraction, we need it for nerve conduction. We do have situations of hyper and hypo. For hypercalcemia, usually from alkalosis, pH too basic, hyperparathyroidism, meaning those parathyroids on the back of the thyroid gland, and they are producing too much of their hormone. And one of the things that the parathyroid hormone does is calcium homeostasis. So if it's secreting too much, it's affecting calcium in the body. And then hypothyroidism, the thyroid itself, because everything is lower. Everything functions slower with hypothyroidism. So what it's going to do, it affects depolarization. If you remember, every cell, when we talked about the muscle and the nerve, it had a resting membrane potential. Does everybody remember that? And when let's think about the two that we look at this with, muscle and nerve. When we begin to get a stimulus, it begins to move away from its resting membrane potential. Is everybody with me? And then we would have that muscle contract or that nerve conduct. And then we would begin to move back to into the resting membrane potential. On this side right here, was this one repolarization or depolarization? We are depolarizing. Over here, we would repolarize. Do you guys remember that? Okay, so too much calcium inhibits depolarization, meaning it's affecting muscle contraction or nerve conduction. Therefore, there's muscle weakness, definitely depression of the reflexes, and because heart is muscle, we are going to get cardiac arrhythmias, and if not corrected, can cause the heart to stop. If there's not enough, usually it's due to like a deficient amount of vitamin D, diarrhea, pregnancy, lactation, acidosis, once again pH, hypoparathyroidism, hyperthyroidism, the opposite, okay? What this does, the nerve and the muscle gets too excited. When we have that situation, when skeletal muscle as a whole, when muscle is receiving too much of an impulse, do you remember how we would see the step, the trepping, okay, in the muscle contraction? But if it kept receiving a stimulus, receiving a stimulus, receiving a stimulus, it stayed up here and went into tetany. Do you guys remember tetany? A sustained contraction. Skeletal muscle can withstand that for a while. Smooth muscle, not so much. Cardiac muscle, absolutely not. Okay? So in a case where we don't have enough calcium, usually the muscles go into tetany, especially the heart, and the only thing that happens is death. Now, something else that can happen with not enough calcium in the blood, in the body, because if you think about the structure, once again, breathing and so forth, these are muscles. And if they go into a sustained contraction, a spasm, the person usually suffocates to death because they can't breathe. So these are very serious conditions with our electrolytes because every single one of them can lead to death if it's too high or too low. Now, in a clinical setting, why would you need to pay attention to these? Why do you need to be aware of symptoms? How to treat it? You need to know how to treat them. You can't simply just go grab an IV bag and give it to them. It's going to become important for you to recognize the symptoms, address other issues the patient may have so that you know that the treatment that they might be getting to be given to them is not going to kill them. I think that's kind of important. Just saying. Which these